And welcome everyone to the fourth installment of the development and analysis of human movement. Today we will be covering the neurological considerations for human movement. So our objectives are almost the same as before, but we're just going to dive in with the perspective of the neurological aspect. So we're going to go over the knowledge of the anatomy of bone, skeletal muscle, and connective tissues. In this instance, we're going to talk about how nervous tissue affects these. We're going to go over some and give you some knowledge on the muscle actions, terms including anterior, posterior, inferior, superior, medial, lateral, supination, pronation, flexion, extension, abduction, adduction, hyperextension, rotation, circumduction, agonist, antagonist, and stabilizer. Mostly during this, we'll be focusing on agonist and antagonist as it relates to muscle contractions. Knowledge of the 6 motor skill related physical fitness components, so agility, balance, coordination, reaction time, speed, and power. Then we will also go over knowledge of the joint movements, flexion, extension, abduction, adduction, and the muscles responsible for them, knowledge of the types of muscle contractions, knowledge of anatomy and physiology of skeletal muscle fiber, characteristics, fast twitch, slow twitch muscle fibers, and sliding filament theory. Mostly we're going to go over fast twitch, slow twitch muscle fibers as they relate to the neuromuscular function. And we're going to gain a knowledge of the normal and maturational changes from childhood to old age. Okay, 1 second as I fix my light. And there we go. So, first off, the central nervous system. What is it? It consists of the brain and the spinal cord, and it's the foundation for movement control and monitorization of the entire body. So everything always comes back to the spinal cord and into the brain. Not necessarily into the brain, but many things do go into the brain, and as we'll learn later, some of these reflexes just happen in the spinal cord when they come from the muscles or the sensory nerves. The peripheral nervous system is the peripheral nerves, the branches that protrude from the spinal cord. The spinal nerve's primary responsibility for muscle action is what these are, and they enter posteriorly and exit through the anterior vertebral column. There are 8 cervical spinal nerves. There are 12 thoracic spinal nerves. There are 5 lumbar spinal nerves, 5 sacral spinal nerves, and 1 coccygeal spinal nerve. So if you look at our picture over here on the left, you can see how it's got all of our cervical, thoracic, lumbar, sacral, and our one little coccygeal nerve down here, all of them labeled. And if you look at the picture, you can see how the spinal cord runs down the middle, and then out of that happens all the little arm appendages. If we look at it in our anatomical model here from behind, you can see right here how each one would pop out, right? Let me see if I can turn this, give you a little better picture. Yeah, so you can almost see how the nerves create, right here, you can almost see the shape of each vertebrae, and as it comes out, as we climb up, right? So the bottom here, and then the arm. Next piece of vertebrae segment here, spinal nerve. And you see the little appendages as they enter the spinal cord here. This pink nerve is the spinal nerve, or the spinal cord. And these are all the peripheral nerves and coming from the spinal nerves here. So this really highlights here our brain and our spinal cord. And we have the spinal nerves that come out of them, and then all down our arms, our legs. These are all of our peripheral nervous system. So when we look at the nervous system, we have sensory neurons and motor neurons. Both of them are afferent and efferent pathways that merge to create a spinal nerve with both signals being intertwined. So what that means is this. So as we go over it, let's start from the top. So the sensory neurons, these are the nerves that enter the posterior spinal cord. They transmit information to the spinal cord and the brain from the body. So they are it's what we think of when you rub your fingers together. These are the sensory nerves that you're stimulating that send the information that this is not a harmful stimulus, that it's a gentle stimulus, does not require any muscular reaction, and it shoots it back to the body and causes a reaction. Now if I took a needle and I poked myself, that would also be the sensory neurons sending the information to the brain, and then the motor neurons sending it back, saying I need to pull away from that instance. Okay? Sensory neurons travel on an afferent pathway. Then we have motor neurons. These are nerves that exit the anterior spinal cord. And like I said earlier, they transmit to the body from the spinal cord and the brain. And these are the efferent pathways. So sensory is afferent, motor neurons are efferent. Okay, and if you look at our picture over here on the left, so you see in the back here, these are sensory neurons, and then here, sorry, this picture is the other way, sensory neurons here, and then in the front of the picture is our motor neurons. Okay, but you see how the back, the front, and then you see how it combines into one nerve here. So while they're separate, they do merge into one pathway, and that's where both signals become intertwined. So it becomes like a positive, a negative wire that go into a main wire, and it's wrapped up. Okay, so let's look at the structure of our motor neurons. In our motor neurons, we have the neuron, the cell body, and the dendrites. Okay, this is just part of it. We'll have more on the next slide down here. Okay, the neuron is what carries the information to and from the nervous system. So over here, you can see how this is starting to come into play here. And then we have the cell body. So the entire structure is our neuron. Then we have our cell body, or our soma, right? So if you look here at A, this is our soma here, the cell body. Okay, it is contained in the gray matter in the spinal cord. So you see this here, this gray matter. This is within the spinal cord. So this is where we're talking about right here. If the somas are gathered outside the gray matter, we call those the ganglia. Okay, this is where you can kind of get some of these ganglion cysts as well that kind of start to bunch up, because these ganglia kind of bunch into a bundle outside of that. I think we talk about that later. Yeah, okay. Then we have dendrites. Okay, so if you look over here, you see A, this is our soma and our cell body. Then we have the dendrites that are like the little arm appendages that stick out. Okay, those are the receptors that bring the info back into the cell from the other neurons. So they actually kind of talk to each other, to the other neurons, using these dendrites. Okay, and the dendrites can and will gather with other dendrites of these neurons to communicate, and they do not communicate with only dendrites from the same spinal nerve. So they'll actually do a little bit of a crossover if they're in the same little region or area, and they talk to each other to give working stimulus from other muscles and other spinal nerves so that they can correctly do their function, do their job, and send the signals and information that they need to and fro the body to make our entire body system do what it needs to do to react to stimuli. Then we have the axon. That's B right here. This is a long nerve from the cell body that exits the ventral root of the spinal cord. It bundles with other peripheral nerves, and it's typically quite large, and it's capable of high velocity signals of about 100 meters per second. So if you think of this in terms of like a wire, it's a pretty thick wire because it allows that high velocity signal to move fast, unrestricted, and just get the information where it needs to go quickly. Okay, it's myelinated. So that means it's insulated, and that insulation is actually Schwann cells. Right here, C is our Schwann cell. So all these little kind of cylinders that are kind of stuck on there, those are our Schwann cells. And then they're spaced by this little node of Ranvier right here. Okay, so it goes Schwann cell, node, Schwann, node, Schwann, node, Schwann, node. Okay, and that's what kind of helps that give the axon that high-speed transmission. Then at the end, you get these motor end plates. Okay, there we go. The end of the myelinated, these happen at the end of the myelinated axon. So when that axon is done, that's what we call that motor end plate. The axon becomes unmyelinated at that point, and these unmyelinated fibers branch off and embed into the middle of the muscle fiber and stop at that motor end plate. Okay? They stop at the muscle fiber, but they don't enter the muscle fiber. They kind of sit within the connective tissue that's bundling those fibers together. And what we call that junction, where that motor end plate and the muscle kind of come together, is that neuromuscular junction. Like I said, it doesn't touch the muscle fiber, and it creates a synapse or a gap between the neuron and the muscle. And that's where that chemical transmission happens, and we start to get these nerve impulses. And that's why you need these kind of neurotransmitters, is what we call them, with like potassium and calcium as they go and they create those chemical activations. So if we look here, you can see right here that how that axon becomes unmyelinated here. And then we get our motor end plates at these little ends here, and this is the muscle fiber, this blue piece, right? And you get this neuromuscular junction, and then you have this synapse here, like we learned about in the muscles, right? In that synapse, which is the kind of that fluid plasma kind of area that allows for the quick movement of these neurotransmitters, and they cross over and tell the muscle to contract, the myofibrils to contract or to relax. What we call that is the action potential. The action potential is the nerve impulse that travels to the neuron to that motor end plate. It creates that muscle twitch. When multiple action potentials occur, we get multiple twitches, or what they call a tetanus, and that's a constant contraction, and that occurs until that motor unit is no longer able to transmit the signal or regenerate the signal, or keep pushing those neurotransmitters across that membrane to create that muscle contraction. Sorry. In these motor units, each neuron averages about 100 to 200 muscle fibers. So each one of those neurons back there, each one of these is responsible for 100 to 200 muscle fibers. And the ratio that of neurons to muscle fibers is the innervation ratio. And the lower the ratio, the finer the motor control. Okay? So our big muscle groups like our quads have up to maybe 1,000 to 2,000 muscle fibers that each neuron innervates. But our fingers have a lower, or our eyes, maybe our eye twitch movements have, or our mouth even, is a lower ratio, because we need a finer control of those areas of our body to do linguistics, to do fine motor skills with our hands, picking up pennies, picking up a pencil and writing with it. So that's why we have that lower control, because it's more of the neurotransmitters activate the muscles and control them a little bit better. So if it's responsible for less muscle fibers, then it can actually have a finer control of the actual individual muscle fibers that it does innervate versus a bunch of them, right? And there's an all or none principle with it. So when that motor unit is activated, all the fibers innervated by that unit fire within milliseconds. Okay, so what that means is whether it's 100, 200, or 5, right? Once that action potential crosses, boom, it activates, twitch happens, and all the muscles that are innervated by the neuron, they fire as well. So when we look at motor unit types, we're looking at muscle fiber types pretty much, right? So you have type 1, type 2A, and type 2B. And we look over on our left here, and you can see that type 1 is our slow twitch, Type 2A is our fast switch oxidative, and type 2B is our fast switch glycolytic. Okay? So what does that mean? Type 1, those are slow twitch oxidative muscle fibers. When it says oxidative, it means it runs off oxygen, right? So oxygen is able to get into there and deliver the nutrients that the motor unit needs. It's typically a 70 to 80 millisecond conduction, or 70 to 80 meters per second conduction time. Okay, and so it's a little slower, and it's about a 70 millisecond conduction time. So the time it takes for that actual signal to happen is a little slower as well. Okay, so we don't really generate much tension with these muscle fiber types. They're better at just doing slow repetitive movement over time. Okay, so this is our slow twitch muscle fiber pretty much. Okay, if you look down here in our nanoseconds and our time down here, which this is the graph I like the most in the bottom left, and you can see kind of how these contractions happen. Right, so you look at the time. We have a solid line across here through 60 minutes. It's able to just continually keep a muscle twitch or keep a muscle activation happening the entire time. Okay, and you can see the force levels in the chart above it. I'm not getting much force compared to the other two muscle fibers, but I'm getting just a steady force, right? Type 2A, these are our fast twitch oxidative muscle fibers, okay? So once again, they're oxidative, so they're using a little bit of oxygen to help transmit those signals and transmit the nutrients it needs to produce that motor unit activation. These are a little bit faster, 80 to 90 meters per second conduction speed. And this is a 30 to 50 millisecond contraction time. So almost half the conduction contraction time that a type 1 slow twitch oxidative muscle fiber has. These are a little bit more resistant to fatigue, and they do create a moderate tension within the muscle. So when we say that moderate tension, we're looking at this second chart here on how much force it's actually able to create, right? And you can see here that the time in minutes, it's about 6 minutes before it starts to really get fatigued. So you see how we have a decreasing activation of muscle fibers as that starts to fatigue heading into that 6 minute. By 60 minutes it's barely activated. Okay, but our force is quite high, right, in Newton meters right here. So we're getting a really good contraction, solid, strong contraction out of that. But then we have our type 2B muscle fibers, which are fast twitch glycolytic. So they use glycogen as their main energy source. They're innervated by motor neurons, and it has a conduction time of about 100 meters per second. So this bad boy is moving pretty quick. And once again, we're at about 30 to 40 milliseconds for the contraction time. So it happens quite quickly. It's able to create a force, and it's able to do that quite quickly. However, the downside is it fatigues rather quickly as well. Okay, so you see here, we're looking at 1.5 to 2 minutes, and that bad boy is fatigued. It drops. But our force levels are quite high, almost as high as our 2A muscle fibers. But we just don't get that very long. So if you think of all these muscle fibers being activated at once, we're going to have a strong burst when we activate our type 2A and type 2B muscle fibers. After about 1.5 minutes, 2 minutes, we are down to just 2 muscle fibers, right? Type 1 and type 2A that are still going, but type 2A is decreasing until we hit about 6 minutes, and then we're really relying on our type 1 muscle fibers to create any force and tension we have. And if we look at how our force is here, by the time we hit about 6 to 10 minutes, our force has decreased considerably. Okay, all 3 of these fibers are found in each muscle in different proportions, however. Okay, so larger muscles like our quads and our glutes are a little bit more type 1 slow twitch, whereas in our gastrocnemius and our plantar flexors, they might be a little heavier in the type 2A and type 2B muscles fibers, in which they need to activate a little quicker, right? And all motor units innervate the same muscle, same type of muscle fiber. So each one of these type 1, type 2A, type 2B, they will all have their own little motor neuron. Oops, forgot to put a picture in there. Recruitment. Tension and force are determined by the frequency and the number of motor units activated at one time, right? So the more motor units that I'm able to activate, then that means I'm going to be able to create more tension and more force um, in that muscle or muscle fiber. So the force is increased by increasing the number of motor units, which increases the cross-section muscle fiber activation. So what we're looking at here is, as we recruit more muscle fibers or motor units to activate, we're going to increase the amount of muscle fibers we activate, which increases the total cross-section. So a muscle with a large cross-section, if I fire a lot of motor units, I'm going to be able to fire and activate a lot of muscle fibers, which is then going to give me a stronger contraction because I'm just using more fibers to create that force. And then we have the size principle, which means, small, slow twitch units fire first, and then we get type 2A, then type 2B. And that's kind of why, if you look back here, 1, 2A, 2B. All right, 2B is just to give us that over the hill, get it going, because it fatigues quickly. So if I was to use it first, that's not the most effective way. Think of a low gear on a truck. To get a big old truck moving, it's not moving. If you ever get stuck behind one at a red light, right? You're standing there. How does it get off the line? Very slow. And then it starts picking up. So you get these type 1 muscle fibers. They fire first to do the bulk of the work, right? Because they can do this low-end work for a long amount of time at a very consistent rate of force. Then you get the type 2A, which creates a little bit more and then the type 2B, which really gets you going and gets the muscle moving into what it needs to do. Okay, small motor neurons equals a lower threshold. So if you don't have a lot of motor neurons, you have a lower threshold. And example, walking is mostly a type 1 muscle fiber recruitment. Sensory receptors. What these do are these create or collect information like a stretch in the muscle, heat in the muscle, pressure, tension, and pain within our body. It's not necessarily our muscle, it could even be our skin as we get some tension. So if I push on my skin, I'm technically going to be pushing on the muscles underneath it. If I rub my arm, I'm creating heat, I'm creating pressure, some tension in there, and possibly even some pain. These stimulate reflexes. So what a reflex is an involuntary neural response to a stimulus. We have the stretch reflex and then the flexor reflex. And the stretch reflex is what happens in the tendon and it causes a contraction. This is what you see when you see someone hit that hammer on the kneecap, on that patellar tendon. It causes a stretch because you hit it in the middle, right? So if this is my tendon here and I hit it in the middle, it's going to cause that to stretch. Right here. Well, it looks like it's contracting. This side is stretching, right? And it causes a contraction in that quadricep muscle, which thus causes your knee to extend. Okay, so as that quad shortens, knee extends. Then we have the flexor reflex, which is a withdrawal in response to pain. So I put my hand over the stove, it gets hot, I pull back, and my muscles flex, right? You pull like that. Over, boom, pull. I got a flexion of my bicep, flexion of my hand, flexion of my wrist. All those happen. Now the reason that this happens all well into the spinal cord, so we get these sensory neurons and these motor neurons that happen as it comes in and then goes out. It happens in the spinal cord, which is crucial in survival, okay? Because what happens is if this was to go all the way up to our brain, we have to think about it then, right? Then we have to create a response. So pain goes in, ouch, hands over, fire. Comes in through the sensory neuron, hits my gray matter, then has to travel all the way up my brain, right? So it travels here, in, says, oh, that hurts. Go up here. What do you want me to do? You probably move your hand. Comes back down, back out, and you pull your hand back. Instead, by this happening in the spinal cord, it comes straight in here, activates, our gray matter is able to decipher, oh, yep, that's move, reflex, ouch, and thus you sends it back on these afferent pathways that are very thick. Remember, they're about 100 meters per second. So very fast, in, out, boom, pull. And then you don't even have to think about it. And then afterwards, you're like, wow, probably shouldn't do that again, right? And that's how that kind of works. So that's why it happens, and this is processed in the spinal cord versus in our brain. So another proprioceptor that we have is the muscle spindle. Now what the what a proprioceptor does is it turns mechanical stimuli into a nerve impulse to create that motor response. The muscle spindle is a proprioceptor that's found parallel to the muscle fibers of the muscle belly, and there's two types. There's type 1A, it's a primary afferent. It's stimulated by the lengthening of muscle fibers. So as muscle fibers lengthen, this type 1A primary afferent muscle spindle fiber is stimulated. And what it does is it sends a signal to the dorsal horn, and it makes a direct connection between the motor neuron causing the contraction. And then it says that spindle can stretch just like a muscle fiber as well. Okay. And type 2 secondary afferent muscle fibers are activated by a higher threshold stretch. They're sensitive to a rate of change, and they're less reactive to slow and large changes in length. So as this happens, we get this tight contraction really quick. So you see here in 413 here, these muscle spindles are sitting in the muscle fibers, right, within the connective tissue of these fibers, and they are able to sense when we get muscle tension, and when it feels that, it tightens it up to protect injury. Okay, so that's what these do. So that's why this one, type 1A, by the lengthening, it feels that, and it's able to stretch. So after a little while, you can stretch these muscle spindles out just like you could the connective tissue in your muscle. And then you have type 2 secondary afferent, which are less reactive to slow and large changes in length and more sensitive to a fast twitch. So these secondary afferent would be like at the end of a sprint when you're trying to rapidly decelerate. That's where these would be more activated, whereas a type 1A primary afferent, if you've ever stretched someone out, when you first put them into like a hamstring stretch, they may get a little tight at the beginning, and that's where these type 1A primary afferent muscle fibers are contracting. And then when you're like, just relax, then these type 1A primary afferent muscle fibers start to relax, and then you can really start to stretch them. You've kind of deactivated them at that point. Now we also have this thing called reciprocal inhibition that happens, and that's an inhibitory interneurons in the spinal cord cause an antagonistic muscle relaxation. So as I'm going and trying to stretch my hamstring, right, the antagonistic muscle to that would be my quadriceps. So as these afferent muscle fibers go into the dorsal horn, this inhibitory interneurons send back signals to tell the quad muscle to relax and let the muscle do as we need, so that the agonistic muscle is allowed to stretch because the antagonistic muscle is shut off. We also have the Golgi tendon organ. What that does is it monitors force and tension in the muscles as well. However, this lies in the musculotendinous junction. Instead of the other ones that lie in the muscle fibers, this happens in the musculotendinous junction. This is a collection of collagen fibers within the capsule, and when the collagen is compressed or stretched through a contraction, a proportional amount of that signal is sent to the spinal cord, so it's able to tell how much tension is actually happening. A contraction at a lower threshold than a stretch. So it's like PNF stretching versus static stretching. So I lost my train of thought, I'm sorry. I'm going to have to come back to that. We talk about PNF stretching and static stretching in a minute anyways, so hopefully it'll come back to me there. So then we also have the inverse stretch reflex. It's an inhibitory stimulus that creates relaxation in the muscle fibers connected to the Golgi tendon organ. This is a motor neuron output that is reduced, right? So what the Golgi tendon organ and the muscle, let me finish. Oh yeah, no, we're good. So in a nutshell, the muscle spindle senses tension within a muscle, and what it does, spindle, I always think of spindle as like a spindle of thread where it's wrapped around. When this senses tension, its job is to protect the muscle and tighten. Okay? Ultimately, what we have to do is use the Golgi tendon organ to be able to sense that and say, okay, this stretch is not too bad. This is okay. And then we get the inhibitory stimulus that creates the relaxation of the muscle fibers connected to the Golgi tendon organ. And the Golgi tendon organ then says, okay, this is fine. This is not an issue. The inhibitory stimulus is created, and the Golgi tendon organ tells the muscle fibers, relax. And that's how we work that. So Golgi tendon organ relaxes muscle spindles, tightens them as protective. Then in synovial joints, we have what are called Ruffini endings, and they exist in and around these joints, and they detect a change in position and velocity within the muscles. That can also kind of help activate some of these. So that's why if you get into orthopedics, we always say at the beginning of someone getting injured, that's the best time that you're going to get a special test on someone, because the body hasn't actually sensed this yet. It's got so much trauma happening that it hasn't detected the change in the position and velocity that just occurred within the joint. And then after you start testing the muscle, it starts to realize, or the joint, it starts to realize that there is some things wrong here. We're getting too much. We need to activate and tense and protect the joint. So once again, I forgot to add a picture, or take this out really. So training, right? This is what we really want to know, like, how do we use this in our clinical practice? Well, the first 4 weeks of a strength training program, where you really start getting back into it and starting to really get stronger before you hit that first kind of plateau, you're not actually getting stronger. What you're actually doing is you're increasing the firing rates of the motor neurons, and you're creating motor unit synchronization, and you're exciting the motor neurons, which thus creates a more efficient muscle contraction, because you're able to now engage more muscle fibers in each motor unit and really create a stronger contraction, put out more force, which is the goal of any type of program, right? And then antagonistic muscles inhibit a little bit greater after you've trained them in those first 4 weeks, and the agonists increase their muscle fiber activation. After about 2 to 5 weeks, though, this starts to level off, and now you really start getting into your actual strength gains. So those first 4 to 5 weeks, we're really getting neural input and motor unit training, where we activate more fibers in the muscle. We're teaching the muscle what we want it to do, teaching the neurological system how to respond to that, and thus we see a greater amount of gains in those first 4 to 5 weeks, and that's why you start to see that little plateau after. That's why that's big on changing up your routine after you kind of hit these strength training programs, right? You do exercises, then you need to change it up, they say, right? You change it up to train your body to react to different types of forces, to keep it on edge, to help train a new neuromuscular motor pattern. There's this thing called the bilateral deficit, which is a loss of the force and neural input through training bilaterally. So as I train a bilateral exercise, I actually have a decrease in the force and neural input through training that way. Okay, so my motor neuron or motor unit activation is actually going to be a little less by training bilaterally. Unilateral training, on the other hand, creates an increased neural input and increases the amount of force that I'm able to put out. Okay, so a single arm dumbbell press versus a bench press, I'm going to see greater motor unit and neural input off my single arm bench press than I am my barbell bench press. Okay, training of one limb neurologically enhances activity and voluntary contraction on the contralateral limb. Okay, this is something that's kind of cool, because there's some things that you can do, like let's say if you sit here and you hands on your chest and you rotate to the left and rotate to the right. So for me, I can feel I can't rotate to the right as well. So what I would do is I would train one side. So let's train the side that has the most rotation. And I could turn that and just really work do 5 to 10 reps and really trying to push to that end range of motion on this side, right? So I'm training that, and neurologically my body's learning when I do this type of motion, I need to be able to do this. This is what my brain and my central nervous system is saying I want to do, right? So that now, after I've done about 10, I can go to the other side, and now I've increased my rotation. That was easier for me to do. It felt better, and that is because when I say primed my body by teaching it what I want to do on the other side first. And you can actually do this by, this is actually one method that I've learned that you could actually train someone to be ambidextrous by doing this and training the good side versus the bad side and paying attention to the fine neuromuscular specifics, we'll say, of one side and how you do that to the other and carry it over. And that's how it stops feeling funny when you throw lefty versus righty and vice versa, because you start picking up the little inputs that you're doing. Specificity training. Specificity training determines the fiber type developed, right? So resistance training increases type 2 fibers, okay? It reduces central inhibition and increases neural facilitation. In the short term, it resists fatigue through training and optimal nerve activation, right? So that's what we do, is we resist training in the short term. We're getting that optimal nerve activation like we just talked about, and that's what we see at the beginning, okay? It's been shown that even, the importance of warm-ups, even 5 to 10 minutes of warm-up increases that neural input through an increase in motor unit activation. So just like I did that rotation 2 seconds ago, right? It took what, a minute for me to do that, right? If I did 5 to 10 minutes of warming up, my body's now, like I said, primed, and it's learned that, okay, this is the muscle motor pattern that he's going to want me to do. Thus, I need to start getting these muscles ready, starting to get those contractions working, increasing the neural input and motor unit activation of those muscle fibers, and it helps get a stronger force output from that. And then an antagonist muscle contraction also helps to increase neural input as well, right? So I don't want to necessarily work just my agonistic muscle. I want to work the antagonistic as well, so that I really work all the neural input and my body's best able to respond to any type of stimulus that is coming my way. Okay, and this diminishes the inhibitory input to the agonist muscle and allows for optimal contraction of the agonist. So by working the antagonistic muscle, I actually diminish the inhibitory input from the agonist, which allows that full contraction of that agonist, because I've now gotten rid of the inhibitory. So when we look at flexibility, we have to look at what is flexibility, and flexibility is really the terminal range of motion of a segment. Range of motion is then divided into active range of motion and passive range of motion for the most part. An active range of motion is a voluntary agonistic contraction. So if I want to raise my arm and I want to check active range of motion of my shoulder and flexion, that is me just lifting my arm here, right? Passive range of motion would be if someone else lifted my arm, or I used a belt or a pulley to lift my arm up, right? The agonistic muscles are relaxed and the segment is moved by an external force. Factors for flexibility that could affect it, are joint structure, right? So if my bones are shaped differently, or I have a bone spur, or in the case of the elbow, right, bone on bone kind of stop that range of motion from occurring of extension of my elbow, because these two bones here, my ulna and my olecranon process, they stop, boom, right? Soft tissue could stop it. I said the quads here, or even you could say your elbow, right? So I can only flex my arm this much, because sun's out, guns out all summer. My biceps a little larger, so I can't get it any further because my forearm is pressing against my bicep, right? So I get stopped there, just like if I'm doing a hip flexion and I'm stretching my leg. You might have a big beer belly and your thighs hit your belly, and that soft tissue is stopping you from going into full flexion of your hip. And then, like in the knee, we have our anterior cruciate ligament and our posterior cruciate ligaments that help restrict extension as well. So these are all factors when we look at flexibility that kind of help limit that and keep our joints stable. So when we stretch, we look at ballistic stretching and static stretching. And what are they? So ballistic stretching is a fast stretch, and typically the faster the stretch, the more the same muscle contracts, right? So you get almost like a bouncing. So ballistic, they say it's quick. It's a good prep for dynamic movements such as the follow through on kicks. So you may see people at like a fence who are going to do kicking, right? And they're working their legs, swinging it back and forth, back and forth. Or the wind up in baseball where you're doing band work, right? A lot of pitchers nowadays do band work on the fence to get their bodies warmed up. And that's a ballistic type stretching. And it's pretty good for working both the agonistic and antagonistic muscles in a joint and getting them primed for the movement you're desiring. The one everyone's very versed in, and almost all of us have heard of, is static stretching. This is where you hold a joint position for 10 to 30 seconds and it decreases the response of the input of sensory neurons. Okay, so after a while you hold it in that position, the position becomes, you get a decreased sensory response because it gets used to it and you just kind of, okay, I'm okay, the tension's okay, it doesn't hurt, right? That's why you never stretch to the point of pain, because now I'm continuing to send a sensory response to the spinal cord, to that gray matter, and thus I'm getting a muscle contraction on the way back as it fires those muscle spindles to say, I don't like this, you need to protect me. Okay, that's why it's important to keep that out of that pain, so that we do get a decreased response from the sensory neurons as they understand that this is a safe, comfortable position, and then you're able to actually get some relaxation of the Golgi tendon organ, and it relaxes the muscle fibers, and you get an actual stretch. Great for the short term, long-term gains not so much. Okay. That's because the muscle stays within that elastic range, right? Remember at the beginning we talked about elastic and plastic zones, right? After long terminal stretching, the fibers enter the plastic region and they maintain this long-term elongation. However, that stretching position is more than greater than 10 minutes of holding that type of position that you start to get that plastic region where it doesn't necessarily return to its original resting position as with a elastic, right? And you should be stretched typically for static stretching after your warm-up or after you're warm. So after practice is great for static stretching. Ballistic stretching before practice, right, or before activity. And the cooling of warm muscle enhances elongation. So let's say you are doing a static stretch, you want to do that 30 seconds to a minute after your workout as you're starting to cool off, do a cool down. That's when this muscle elongation is enhanced by that muscle cooling off after activity. So that is all I have today. I hope you guys enjoyed it. I will see you in lab. Don't forget to bring your items. Go to the shed first to get your cardboard man. And then we're going to have about 30 minutes to start class and to put your cardboard man back together. And then after that, we're going to test them. Okay, 10-pound weight. Hope everyone's excited. And yeah, next week we start breaking into the body. So we start to do some of the anatomy. We start learning some joint ranges of motions, some end feels. So we're going to do a lot of hands-on partner stuff next week. So that should be pretty fun and really start getting into it. So it'll be good. All right, everyone have a good week. Take care. Don't forget to do the test. Don't forget your message boards or discussion boards. Don't forget to respond. And we will have open office hours on Wednesday, 12 to 1. All right, everyone have a good day and take care.